Welcome to the very first official episode of United States of Sit Care. I am Tamara Young. I'm your host, and this is a podcast where I bring on guests who are experts in their respective fields in health and wellness, and I ask them about why our United States kind of allopathic model of healthcare is broken, and about their specific areas of expertise and their experience in treating patients, and so on and so forth. My very first guest today is Dr. Christian Canete. He is a chiropractor, and there are a lot of perceptions about chiropractors. Mine, for instance, before I started working with Dr. Canete was you go to a chiropractor if you get in a car accident. That's about all I knew. Others have this perception of chiropractic as more of a woo-woo, voodoo medicine kind of space. Like, it's not real medicine, it's just kind of fluff. So I'm really excited for you to hear from him on his experience in healthcare and vetting various areas of expertise and which kind of medical path he wanted to go down. And we dive into some, it gets a little bit tinfoil hat. This episode is going to be pretty hinged. Although Dr. Canete, in addition to just his wealth of knowledge on how to stay healthy and the importance of his work making sure your body functions the way it's intended to function, and coaching people on healthier lifestyles and nutrition, he also takes us down a couple of his favorite rabbit holes regarding things like the pharmaceutical industry, the profit motive that is inherent to our healthcare model in the United States, and his thoughts on why we have some of the poorest outcomes to show for it. So without further ado, here's my interview with Dr. Christian Canete. Okay, so welcome to our first official episode, my first official human guest, Dr. Christian Canete. And Dr. Canete, it's hard for me to get in the practice of calling you by your actual name because I was introduced to Dr. Christian as Dr. Muscles by my husband. So he and my husband met at the gym years ago. And then after my husband and I were married and I was pregnant with Joelle, our first, and having some aches and pains, he introduced me, and I think it was several months before I actually knew your name.
It's been several months since I've known my name, so it's just
we're in the same club.
Yeah, same page.
But really quickly, Dr. Christian is a chiropractor. Obviously, he owns Chiropractic Works here in Nashville, and he fixes backs and kills fat. And I love his motto: "It's hugs, not drugs." And he also kind of along the way, as he builds relationships and rapport with patients, he has a really cool relationship with their just overall wellness. And it's why when I knew that I wanted to interview guests and actual experts on this podcast, he is the first person I thought of because he's actually helped me. So here we are.
What an honor it is for me to be on your first episode in your podcast. I think that this is going to be such an amazing venue for you to for people to listen to and to glean knowledge and information, hopefully.
Yeah. We were joking before we got started recording that Dr. Canete was like, "I just hope I don't, ruin your first episode." And I was like, "That's funny. I just hope I don't ruin a podcast where I'm actually interviewing people." But this will be very conversational. I know that you have a wealth of knowledge to share. I mean, y'all, just over the course of getting to know this person, he has a wealth of knowledge. This conversation could go any number of directions. So I'm excited to see where it goes. But I wanted to talk first about, you and I share a passion for just arming people and empowering people with more information to kind of get outside of this box of this is what US healthcare is. And so this is how I have to kind of wait till I'm sick, take drugs, get surgeries. We think of even chiropractics and various wellness tools in really tightly confined boxes. Mm-hmm. And so I wanted to start with just you sharing your journey and your kind of story to what got you here, what got you into chiropractics and kind of interested in health and wellness.
Yeah, well, absolutely. So my mom, who is my hero, she is an operating room nurse. And so at a young age, I feel like my wiring I'm wanting to help people. And so uh, I was considering going to med school, considering getting into dentistry, and considering going through the regular Western allopathic um, routes to healthcare. And my mom, who had worked with a very prestigious ophthalmologist back in Canada, he and I sat down one day and we talked about my future endeavors in medicine. And he was excited for me to pursue medicine and go to med school. But he wasn't very, he told me honestly that, hey, if I had the opportunity to do this again, it took a lot of time and a lot of effort, and I'm glad and I'm happy to be where I'm at, but it doesn't afford me the time to be with my family as much as I'd want it to be.
Mm.
And it was over a 12-year long investment for him to go to school and then to get his doctorate and then to specialize. So in my head, I thought, well, the trade-off would be, sure, you make a nice living, but what kind of living are you actually doing?
Mm.
And then I was considering dentistry. My girlfriend at the time, she was a dental hygienist, and she was telling me that the hygienist that, I mean, sorry, the dentist that she was working for would have to take his blood pressure every week, and that his best friend at the time, who was also a dentist, had a stroke at the age of 45. And I thought, well, maybe the lifestyle of a dentist isn't the best thing for me either. And then just growing up being at the dentist's office and waiting for long periods of time trying to see the dentist and not really enjoying or wanting to be there, that kind of shifted my perspective. And I thought, well, what else could I possibly do? And it was around, like, literally just a friend of mine who was just about to leave for chiropractic school. We were discussing what our future careers were going to be. And he said, hey, you should really check out chiropractic. And I was like, voodoo? Why would I want to do that? Because my parents, we didn't grow up, or I didn't grow up considering anything other than the standard westernized medical model. And
Mm.
so that for me was pretty eye-opening, and I got educated right then and there. And he said, it's not what you think it is. Chiropractors actually help a lot of people get better without drugs or surgery. And I
Wow.
thought, I really had no idea what chiropractic was. And thankfully, I had the initiative enough to contact a chiropractic school and get information on graduates and to see if they had any contacts of any doctors in my area that I could go interview and just talk to, because that's really what I wanted to do. Was I have no idea what chiropractic is. I should probably learn about it just to see if it's even an option for me or not. And as soon as I went to his office, and it was a completely different atmosphere than what I was expecting. The patients were happy to be there. They didn't wait for any longer than 5-10 minutes. And when he started explaining to me what chiropractic was, it blew my mind to be able to try to help people feel better, and to not just feel better to get out of pain, but to allow their bodies to heal the way that they were meant to without drugs or surgery, and with just two hands is essentially what it was. And so within that first 2-hour meeting, it was almost like I knew exactly then and there, this is something that I want to pursue for the rest of my life. And for the next 2 months, 3 months, I would drop into his clinic and spend an hour and a half, 2 hours, just observing, just seeing what his day-to-day routine was. And it wasn't much longer than that until I convinced my parents that this is what I wanted to do. And I submitted my application, got all my courses in order, graduated, and within 6 months, I was in California.
Mm. That's not the answer I expected, honestly. I didn't know that. I assumed you were always into voodoo and that's what attracted you to it.
Yeah, most people like look at me and they're like, "Ah, yeah, this guy's odd," for sure.
Well, for sure. Well, and
Yeah.
but that's so interesting that you were more coming from the perspective of like, what is the life of, like, you weren't looking for necessarily just a degree that carried clout
Oh,
or
yeah, right,
the money necessarily. You were
right,
interested in like, what does the life look like of
right,
that like how do they serve people and what does their life look like,
right,
which is
right.
pretty cool. And we share that similarity. I grew up in with a family members in the medical field. My dad worked for a major hospital system, and
Oh,
my
right,
mom
yeah.
was an RN in outpatient surgery. My whole upbringing, and so I was very much in that mindset too, similar to you. It's like the pill for an ill. Like you
Yes,
sick, you take a
exactly.
pill. You get in a wreck, maybe you see a physical therapist or a chiropractor.
Right.
Everything happens in a vacuum, and
Yep.
we're not honoring really. There's no thought at all. I'd never crossed my
No,
mind we could honor like the way our bodies are naturally meant to function and the realm of things that are so within our control.
absolutely.
Um,
Absolutely.
that's so interesting. So about that perception, because it was, I didn't realize that people had this perception of chiropractors as like voodoo magic or woo woo or alternative. Because I came into chiropractic with the understanding, I always thought of chiropractors as somebody that you see if you're in a car wreck.
Mhm, right.
And so I want to talk about that for a second, just
Sure.
general perceptions around what it is that chiropractors do. If you could just distill it down,
Yeah.
what is kind of the core, what are the core tenets of chiropractic care?
So I think back when I started school, I want to say only about 9% of the population, then at that time when the statistics were presented to me, only 9% of the population utilized chiropractic care. So that really supports the notion that no one really knows what chiropractors do. You know what I mean? And so what we're trying to do is we're really, as chiropractors, just trying to allow your body to function as optimally as possible. Like that's really to distill down to the most basic core tenets is just allowing your body to heal itself and letting your nervous system function the way that your nervous system was designed. But because the way that our anatomy is designed with our vertebra protecting our nervous system, and these vertebra being a series of bones that hold the nerve roots that exit and uh, out of your spinal cord that attach to all the different parts of your body. These vertebra can get misaligned from just daily life and living and poor habits and the way that we sleep and just how we do life. We can not allow these nerves to function as well as it should. So your brain then therefore cannot communicate with the rest of your body as well as it should. And really that's kind of how we are here in North America. Our bodies are not functioning as well as it should.
And that's what we don't think about a lot of times is when you talk about that kind of brain body connection, we think in the kind of in the realm of what chiropractic care does is you think of like the brain signaling muscles and
Right.
joints
Sure.
and like pain signals.
Right.
But no, we don't realize we're also talking about the connection between your brain and your vital organs.
Absolutely. Absolutely. And your digestive system. I can't tell you how many times one of my favorite stories with when working with a chiropractor, when I first graduated from school, I had the honor of working with a phenomenal chiropractor back in Washington State, Dr. Stephen Clark. And it became so much more real to me after working with him for about 2, 3 years. He would have a stream of patients come in who were told that certain things wouldn't happen in their lives, whether it be with pregnancy or with allergies or with just whatever dysfunction that they had. And digestive issues, elimination issues, respiratory issues. And we would get these patients that would come in with their symptoms completely being eliminated or severely or significantly reduced with half the medications or no medications. We've had patients that would come into this clinic who, after several years of trying to conceive or have a family, after seeing I don't know how many specialists, come into the clinic with 3 or 4 children in tow. And the common joke was, Dr. Clark got me pregnant.
That's
And it's just, you know what I mean? So it's not so much about like what can we do for you? It's more like how much better can we help your body function?
I love it. So take us down a few, I would say maybe rabbit hole's the wrong term, because maybe you could take like a short like peek down a few rabbit holes, because there are so many of these lesser known benefits of seeing a good chiropractor.
So I think
For you to cover, because I've learned about through working with you, and also I listened to an ADHD podcast, and one of the just super practical tips is like, if you have ADHD, you need to be working with a chiropractor regularly. And I was like, why is that? But there are all of these benefits to your immune system. I mean, what you do has so many implications. And so I just wanted you to pick a few and maybe talk about those.
So I think like so many of our patients that come into the clinic, we get your day-to-day neck pain, back pain, headaches, jaw pain. We also, so those would probably be under the category of why would I see a chiropractor? It's like aches and pains. Some of the more fun things that we do are, and statistically with chiropractic as a profession and not just our clinic, a lot of chiropractors are helpful with children that have ear infections, helping the eustachian tube drain so that ears don't get infected as easily. And a fun part of our clinic that we see a lot is helping people with elimination issues and digestive issues.
We're talking about poo-poo.
Yeah, exactly.
Yes. Dr. Canete has helped my baby poop. She helped Jocelyn. She was having some issues. She had some colicky issues. This was at the very, very early on in my kind of own wellness journey, before I knew a lot of this stuff. And Jocelyn had colic pretty badly, and part of it was digestive. And he did help her poop that one time.
I don't know why that tends to happen, but for whatever reason, people find me and they're like, hey, I've heard that this is what happens in your clinic. But to reiterate that that one patient that I like to talk about, who after spending, gosh, I don't know how many weeks, her daughter was 21 days, 0 bowel movement, and had gone through several specialists. Their 3-year-old had, at the time, all these medications that didn't help her go to the bathroom. And so she called our clinic and she said, hey, this is what's going on with our daughter. Do you think you can help her? And I said, well, I'm going to do my best to let her body function the way that it was meant to. And so she comes in that day and I adjust her daughter. And I said, well, there's obviously no guarantees, but we're hoping that this helps her nervous system function better. And then I get a phone call later that evening with her mom, excited, saying that, hey, my daughter just clogged her grandmother's toilet. So, and just more recently, our son unfortunately had I think he had the flu several months ago. And my wife didn't tell me this, but he didn't go to the bathroom for 4 or 5 days. And then I was like, oh gosh, I wish that you had told me, because I would have adjusted him. But because of our lifestyle and like the time that the kids go to bed and the time that I get off work, I don't often see my kids, thankfully. But just kidding, I love my kids. But so I adjusted our son Hendrix, and within half an hour, he had done every single thing in the bathroom that you can think of. Everything came out like all at once. So that was quite, I don't want to say I don't want to use the word enjoyable, but it was quite a successful adjustment, I think, to be more accurate.
One
So
word for it. Yeah.
yeah.
That's great. What about the immune system?
So that's another crazy thing too. So I get adjusted regularly, and I also obviously, just as a chiropractor, I watch what I eat and what goes into my body. And I've been practicing now in Nashville since 2007. Moved to Nashville in 2006, and I cannot for the life of me remember having a sick day. I don't think I've had a sick day off of work. I've had allergies. I've had allergies here and there, but nothing debilitating. I did have food poisoning back in 2008, and another stint of food poisoning, but this was only about 3-4 hours, so I didn't call off work. But anecdotally, if you allow your nervous system to function, your immune system should be able to function. And then also, if you don't put as many toxins into your body or onto your body should function better. So anecdotally, I've seen that my patients too, when they come in, they complain less about getting sick, and they complain less about the severity or the frequency or the duration of their allergies, or that when they do come in and they're sick, they're not sick for very long.
Yeah. That's so interesting. And I love that you're really transparent about that. Is that while there are specific issues that you could get a pretty immediate payoff from going to see a chiropractor, so much of it is about if this, like seeing a chiropractor isn't going to make or break you getting sick or not,
Right.
or it isn't going to make you never get sick. However, it can break the kind of process that your immune system needs to go through, or pick a system, your digestive system, whatever. It can be like a limiting factor.
Sure. Oh, absolutely. And I think also too that when patients come in and they're kind of at their wits' end in terms of like how they feel, a lot of people that come in are just sick and tired of being sick and tired.
Yeah.
And it's not just like they're sick that day, but they've been sick consistently, or they're just not feeling well and they haven't been feeling well consistently. And so one of the things that I enjoy talking about in our clinic, like one of the things that I really enjoy is just really connecting with my patients and trying to figure out how it is that the best way that I can serve them, and how can we make this journey as painless and as most enjoyable, because secretly what I'm helping, or what I'm trying to do, is to try to help them and empower them to make more responsible decisions for their health and wellness over time. Because we know that most of the time, these changes don't come overnight. And that's I think that's one of the discussions that we have a lot at the clinic, where people come in and they have aches and pains, and they always want to attach their ache or pain to some singular event, some traumatic event that happened once.
Mm-hmm.
And I argue that I don't feel clinically, in my experience, that really isn't how it happens. When people, for example, I had a patient a couple years ago talk about how he was mowing the lawn and turned the lawnmower just a certain way, and he felt an immediate pain in his low back. And he's like, yeah, I think it's because I was mowing the lawn and I turned the lawnmower a certain way. And I said, well, that's possible, but I would argue it might not necessarily be because you shifted your weight and you stepped a certain direction and moved the lawnmower to tweak your back that one time. It may have also been the 4,682 other times that you moved your lawnmower like that. So it's more like the idea of the straws that add on top of the camel's back, and then eventually that last straw breaking the camel's back.
Mm-hmm. So regular relationship can help kind of heal as you go, in a sense.
Yeah, absolutely. But then also too, just like trying to help patients understand that what they do on a daily basis that might seem innocuous, or that might seem that, hey, this isn't going to hurt me, poor posture over time, poor sleep habits, poor sleep posture, all these things over time multiplied can certainly have a tremendous effect on patients and how people feel or how people function. And I see this every day when I take x-rays on my patients, and then I show them their x-ray films, and they're like, well, how in the world, why do I look like such a train wreck? Like they're like shocked as to why do I look so misaligned? Is it because the last time was it back in 2020 when I fell off a tree? Is that why my neck looks like this? And so it's just kind of unpacking, well, what is it that you do on a daily basis that you don't even know about that's affecting your spine? Like, what are the things that you do preferentially to not have a spine that's aligned properly?
Yeah. Do you find any resistance there? Because I can imagine in this day and age in particular that there's this expectation. No, I come in so you fix me so that I can keep doing everything as I'm already doing it.
Well, I think that what we try to do, I've spent enough time in the clinic and talking to people. I want to help them understand, like, set realistic expectations, I think. And people will come in and they will be in pain and they think it's just going to be one magic adjustment. You know what I mean? And that adjustment might help them significantly to reduce their pain and for them to feel better. But I certainly don't want them to think that that's how it's going to happen all the time, or that it would happen on their first visit. For us, we want to help educate our patients as much as possible as to the process of chiropractic, and what it really is how can we not just get you feeling better now, but how can we get you feeling better permanently and get your body functioning better for the next 100 years.
Yeah. So what I know that we technically already talked about crap, but I would like to crap on the pharmaceutical industry a little bit with you.
Sure. Yeah,
It's
absolutely.
one of you say it a lot. You say hugs, not drugs. So
Right.
can you kind of explain that? And
yeah, so that's I can't, that's not mine. I borrowed it from,
Sure.
I've heard, hugs not drugs, and that goes along the lines of hugging and love and not using drugs. But the technique that I employ at the clinic, I've adjusted you this way, where you're laying on your back and I adjust your middle back, and it's like a hug.
Mm-hmm.
And that generally is what I'm trying to encourage people. It's like, hey, you should hug yourself, or let me hug you professionally with chiropractic. So chiropractic hugs, not drugs, because the reason why you have a headache isn't because your body lacks aspirin.
Mm-hmm. Well, and you mentioned earlier on when you were kind of sharing your story, you mentioned the word, and I want to like educate as much as possible on this podcast in layman's term, but you mentioned like Western allopathic medicine. Can you explain what that is?
So growing up with mom, whenever we had aches and pains, and like also too, this is crazy. So for any of your Filipino guests that listen to this podcast, but my grandmother loved Vicks, like Vicks Vapo Rub. So whatever we had, if I had like not allergies, but if I had the flu, or if I was sick, or she would slather that stuff on me like nobody's business. Or like we would take, what is it, the NyQuil or something like that. What back then when I was a kid, there were myriad of
Robitussin.
Yeah, like I don't even know what because we don't use them in the house. I don't even know what like those names for like decongestants, and headache stuff and aches and pains stuff, like that stuff, like that.
Cough suppressants, all of that stuff.
Right. So that would be the stuff that I would live off of as a kid whenever I would get sick. But I feel like that's like the model that the majority of Americans employ whenever they feel like they're not, whenever they feel sick. Like, hey, I feel like my nose is congested, or I can't I can't breathe very well, there's a pill for that. Or I've got a headache, there's a pill for that. I remember I shared the elevator with this interesting gentleman one day, and I was at a chiropractic seminar, and I walk into the clinic. I walk into the elevator, and he greets me, and I say hi, and he was like, "What do you do?" And I was like, "Oh, I'm a chiropractor." And I asked him, "Have you ever been to a chiropractor before?" And he's like, "Oh, no, there's a pill for that." and I, and I looked at him and I laughed so hard that it was almost like it was along the lines of, "Oh yeah, that's great. That's a great way of being responsible for your own health and wellness, is by taking a pill to just cover up your symptoms, but not to actually deal with your symptoms." Needless to say, he got off on the next floor after
Right.
that.
Scared that one off.
Well, it was just like, it was kind of weird at that point.
Yeah, that becomes a little bit awkward. Yeah.
Yeah.
What is it about? What do you think it is about chiropractic that attracts, or maybe it's in reverse? I've just noticed around me a lot of chiropractors are really healthy people. They're really healthy. They take good care of themselves. They're active. They're generally pretty fit. And I know I'm making an overgeneralization here, and I don't want to stereotype, but it's just a trend that I've noticed. And I'm like, what is there something about chiropractic that attracts really healthy, active people, or vice versa? What do you think the correlation is there?
Wow, that's such a great question, because I love that question, because it really is the reason why I love chiropractic so much. I don't know if you know this, but prior to chiropractic school, I was 230 pounds, 30% body fat. I couldn't do a push-up to save my life. And thank God that I had classmates back in chiropractic school who were really into fitness or health and wellness. And the best thing that had happened to me at that time, which I thought was actually the worst thing that had happened to me, was my girlfriend of 9 years broke up with me halfway through chiropractic school. And I remember looking in the mirror going, "Who's going to want to date this loaf of bread?" Like, nobody. And that was the impetus for me to start to really understand, hey, well, because I didn't want to be single for the rest of my life. But I thought, I need to present a better package to any likely suitor that I might find attractive someday. But then after that, was kind of like, so the health and wellness and the activity part of me going through chiropractic school, I felt like was in the beginning therapy, but then I felt, after seeing changes in my body, and also just having a lot less stress and eating better and feeling better, I feel like the reason why I think a lot of chiropractors are more inclined to be more active and to be healthier people is because not only are we very, I feel like we're more in tune with what we put into our bodies, but also, just for me, I can only speak for myself, but I feel like I'm indebted and responsible for the patients that come into my clinic. And if I'm trying to help my patients be healthy and well, I can't just talk the talk. I have to walk the walk. And so for me, I feel accountable to the people that come in my doors, and so that they know that what I'm telling them, and how that they too can be healthier and to feel better without having to use any drugs or medications. I mean, if I can do it, I feel like anyone can do it. Or if I'm still on that journey, I'm not saying that I'm where I want to be, but I'm certainly much further away than when I first started.
Now that's making so much more sense, knowing your story there, how that's translated to, you offer a service that's a non-invasive, drug-free way to kind of kill fat and help there, just from a more kind of aesthetic point of view. But and I know this because you worked with my mom. It is not, you guys, it's not like a, kill fat treatment. It is like, as my mom says, therapy, nutrition coaching. Even though you're not a nutrition coach, I've learned more about nutrition from you than so many other people just talking, while I'm in your clinic. But can you talk a little bit about that kind of relationship dynamic with the clients that you see and why you hammer on nutrition so much?
That's a great question too, because I didn't really have any intentions of doing the machine is called CryoSkin, and it was first invented in Italy or France, and then I think it was put together technologically in Italy, but I think it's been in the States now for about 4 or 5 years. But so, anyways, I had no intention of actually getting into cryoskin way back then. But what I've noticed just over the years of practice with the patients that come into the clinic and me trying to help encourage them to live the best life that they could possibly live, because this is the only life that you get. And we're living in the South, and I can't tell you how many patients come in through my doors who are morbidly obese, who suffer from all these ailments because of the excess weight that they carry. And so, unfortunately, I've just kind of gotten really jaded about having to tell these people that come in, I can only get you better so much, but if you're not going to be taking any personal responsibility for the excess weight or the choices that you're making, I can get you feeling better temporarily, but unfortunately, you're going to be back here in the next couple weeks, the next couple months. And one of the things that I like to talk to my patients about are some of the things that they can do on a daily basis that can help kind of change their lifestyle habits so that they can make these changes happen just gradually over time to push the needle in that direction. And so, jumping onto the body contouring wagon, that was just to help my patients start to see the changes faster. Because I would get patients that would come in and say, well, I tried this and I tried that, and I would see the changes, but it wasn't it wasn't happening as fast as I would like. And so they would see that just trying on their own, either with like trying to eat better or to eliminate certain things. But unfortunately, what if you go back to it's so much easier to go back to your old habits.
Yeah.
And so it's like I would tell them, it's not like you can eat 2 or 3 salads and expect to see a 6-pack. Like,
Yeah.
this is going to be a lifestyle change. So the reason why I jumped onto cryoskin is just to help kind of make that transition happen a little bit faster for my patients, but then also provide a non-surgical and non-medically involving no medicine or drugs to help them with their contouring needs or their contouring goals or their body transformation goals. But what's great about the cryoskin service is that our patients come in either on a 10, 20, 40-week program. And within that time, we have goals set for them where if we've eliminated a certain amount of volume per session, it's up to them now to make those certain life choices in order for them to stay on track so that they do reach their goals. So it's kind of like this ploy that I have where we can start making subtle changes, but put the onus of the goal setting on my patient, saying, hey, this is where you could be, but it's not just going to be the machine that does it. It's also going to have to come from you, and for you to make the appropriate choices. But once you start making these appropriate choices for you and for your body over X amount of time, then it becomes easier. And then as it becomes easier, it becomes a habit. And so these transformations that we see at our clinic it's really encouraging, but I tell them right away, it's like, this is not going to happen overnight. It's a matter of changing your lifestyle habits so that it becomes permanent.
A machine is just like the dangling of the carrot to see
Yeah. Yeah.
accelerated results. Well, I applaud you for talking about nutrition because, and this is no knock on doctors, because it just isn't, most physicians don't even get the most basic of nutrition training in the
Right.
US. But I cannot think of one single time that anytime I saw a specialist or a primary healthcare physician that food was brought anywhere near the conversation when discussing like very obvious, what I now understand to be very obviously food related issues, at least as a cofactor.
Right.
And it's arguably one of the biggest factors and or cofactors in our health and wellness. It is so important, especially when we consider not just like the nutritional value of foods, but what we have to deal with in terms of processed foods and dyes and pesticides and agricultural runoff and antibiotics and hormones in our foods. It can feel really overwhelming, but I love the work that you do, because what seems very overwhelming is actually really simple. You know, you think of a couple foods you can add to your diet, and then before you know it, you're like, okay, I'm in a routine there. Now I can buy this set of produce, I'll buy organic, you know. And then you get into a routine there and you're like, you know what? I think I'm going to look for folic acid on labels and not buy it if it has folic acid.
Right.
You know, those types of things. And then it snowballs. The more you learn, the more you can kind of adjust. And before you know it, you're eating completely differently and you're feeling better.
Right. Absolutely. And I think that too, what I encourage my patients to do is, just because a certain eating plan works for me, doesn't necessarily that same eating plan is going to work for everybody else. And one of the things that I really enjoy is kind of using my body as um, my own experiment and see
Yeah.
what works best for me. And so I can only speak of my experiences with certain foods being included, certain foods being eliminated. And so I'm on this pursuit of like finding the fountain of youth without drugs.
Yeah. Have you ever heard of, I'm going to nerd out for a second. I just started reading a book called Dirty Genes by Dr. Ben Lynch.
I have not.
It would be so up your alley. It's more kind of in the epigenetics route. But he talks about various, you know, how we think of genes as like it's coded into us, it's fixed, it's permanent. And he's essentially talking about biohacking, that no, you either work with or against your genes, depending on your eating, your lifestyle, your toxic exposure, sleep, all of the same things that you talk about. He just talks about them in the context of specific genes that tend to be dirty or clean and cause a variety of health issues, but also have a flip side of benefits to them if you have those genes. So for example, I may have a SNP in one gene that causes me to, you know, have symptoms of like inattention and spaciness. Sometimes I may easily get burned out and anxious and have, you know, various skin sensitivities. But the flip side of that gene is I can be, you know, super focused and driven, and I can have a lot of energy and optimism. So there's like a lot that's in our genes that he talks about that's really cool. But it's really, that would be a dream scenario I'm putting out into the universe. Forget, you know, like important enough, like
That's
for
gonna
more than
happen.
5 people to listen to my podcast, have Dr. Ben on.
I feel like that's gonna happen faster than you know it.
Right. Well, let's just put it out there. We'll believe
Yep.
it.
Absolutely.
Well, I want to ask you I have to ask something that like at least borders on controversial, or it wouldn't be me.
Mhm.
So I want to bring on guests to just ask about, you know, this overall concept of this podcast is that we live in a sick care system. That is the predominant model in the US, and it isn't working.
Right.
So I would love for you to talk about, what would you like more people to know about the Western allopathic model, and along with that, any kind of piece or pieces of advice you would give to kind of circumvent that and go a more preventive, like well life kind of path.
Gosh, this question, we could spend like how much time do we have?
Oh,
Like
it's a loaded question,
we can
100%.
we can spend such a long time on this one subject, but unfortunately, I become one of those tinfoil hat wearing conspiracy theorists
Yes.
when I even mention the idea that there might be a hint of profit that might somehow persuade the information that we receive in terms of but people don't, but unfortunately people don't want to hear that. And the sad thing is that we just, are we officially out of the pandemic yet or not? Or I don't know. I don't watch the news, so I don't know if we're still putting masks on or not. I don't think people are still masking, but
Some people are. It
yeah.
depends on who you listen to, which day of the week it is.
But that's the point though. It's like when we were talking back before or or during the very beginnings of the pandemic, it's, well, you listen to the science, but then when science is presented in different lights, it's like, well, don't listen to that science, listen to this science, or listen to these doctors, but don't listen to these doctors. Don't
Listen to the science that the pharmaceutical industry paid for. Listen
but
to the science that big processed food giants paid for. Don't listen to independent science.
But why would, but people don't want to, like, they don't want to hear that. And that I feel like is what I don't quite, well, I guess I do kind of understand it. And I feel like unfortunately it goes back to the whole idea of being responsible for your own health and wellness. And unfortunately here in North America, we really aren't taught how to be responsible for our own health and wellness. What we think is, well, we just go to the doctor and they tell us what to do without any question.
Mhm.
I love it when patients ask me questions about certain things, or that they even question the techniques that we do at our clinic, because for me, it's like, oh, you're actually invested in your own health and wellness, and you want to know what it is that we're doing so that we can help you get better. But no, it's not me that's making you better. It's your body that's making you better. I'm just trying to help clear the interference so that your brain can communicate with the rest of your body. But then also, I want your body to function as best as it possibly can. So let's try to like cut down on the cake and the ho-hos and the ding dongs. You know what I mean?
Yeah.
And so, but when you start, when I start talking, I think the circles of people that I have here, we're all, a lot of my friends and family are somewhat, I mean, sorry, my friends here are kind of like-minded, but when I go back home to Canada, it's a different story. Unfortunately for them in Canada, we see this really, the difference between Canadian thinking with the health and wellness now, especially post-pandemic, it's pretty scary to see just how
Authoritarian almost.
I'm sorry.
Authoritarian, maybe.
Oh, very much so. Like just, but then also just the, like the brainwashing, unfortunately, the propaganda that's disseminated in Canada, and how virtue signaling, it's just, it's so unfortunate, but there's no other, it's only this kind of information gets disseminated, but not anything else. And if you're thinking about anything else, those people get ridiculed, they get shunned, no one wants to talk to them. And it's frightening, really, just to think that, oh, the government has our best interests in mind. I mean,
You're bringing back a memory I have of, I can't remember what my issue is, but I had come to see you at one point, and I was like, I don't know if it's this causing it or this. And you looked at me and you were like, well, what do you think it is? And I was like, and I went home and told my husband about it, because I was like, at no point in my life has a provider ever asked me, like, well, what does my gut say? What do I suspect? What's my feedback? And I have a lot of empathy for someone who is to any degree brainwashed by the current model,
Right.
because I come from it, and it took me getting really, really sick and having children who were getting sick to wake up and to learn to, like, maybe that's actually my gut nudge. Maybe I should honor that a little bit, because I saw so many I gave birth in hospitals. Let me just tell you, I gave birth in hospitals. So I know about like feeling a gut inclination of, I don't feel like they should be waking my newborn up for the 30th time today
Right.
to weigh her again. I know all about like ignoring my gut,
Yeah.
because you're in the system. So you're going with things because you don't know anything. You're
Right.
just the woman giving birth. You don't know anything. They know everything.
Absolutely.
Whatever they ask you to do, there's a reason for it that you couldn't possibly understand because you didn't endure 4 years of, 8 years, whatever, of medical school. And
Right.
so, and I went while I was pregnant. I really adored him as a human being, but I was pressured to get a certain shot. And I was pressured he told me stories belittling women who wouldn't. And that he made one of them cry, and he would tell me these stories, and I got a shot that was never ever tested on pregnant women. So
Wow.
and I won't mention what that was. But, then as I started to become sick, and then of course as my babies were having issues too, and doctors were advising things that I was like, oh, I don't know, but that's what the doctor said.
Yeah.
At a certain point, you just go, like you said, all that's left to do, if I don't want to exhaust all my time and energy and resources and exhaust my health over it, is to take responsibility and, do whatever I need to do as an individual to take care of myself.
Yeah, I feel like that unfortunately is just it's what I call the easy button here living in Western culture, how people want things they want instant gratification. Does that make sense? Like if they have a pain, just take a pill. If they're fat, or sorry, if they're carrying more weight, then there's a pill or there's a surgery for you. So there's like some silver bullet for whatever it is that ails them. But no one really ever talks about, like, here, at least I don't see anyone really talk about like what are the things that you can do holistically or naturally that can push the needle in that direction. And the reason why I say that is because parts of my friends and family that don't think the same way that I do, their excuse is like, well, my doctor wouldn't want to hurt me. Like, why would my doctor want to hurt me? Like, my doctor knows so much more than I do. They are on a pedestal. Why should I question their knowledge?
Mm-hmm.
But I'm like, well, that's kind of how you learn and how you take more responsibility for yourself, is taking the onus of learning on yourself and figuring out, do these things add up, and should I be doing this, and should I be doing this to me? But not only should I be doing this to me, should I be doing this to my children or to my family?
On that note, to that pushback, because that's a common pushback I had. Like I said, I loved that doctor that I just mentioned. He was
Sure.
wonderful, and I believe he wanted the very best for me.
Oh,
But
absolutely.
it's like I heard this actually last night on a completely different subject, but the same is true, I think, of the medical establishment. I'm wondering what your feedback is on this, but they're like, you couldn't go to someone who works at the CIA and ask them what's everything that's going on at the CIA. They wouldn't know
Yeah,
because they're operating in silos.
sure.
That sound familiar? I mean, our
Yeah.
medical industry, they're operating in silos. So it's like, to think that that might not be to your benefit as an individual or of benefit to your family. It almost, you imagine like, well, somebody who means me ill is passing the baton to somebody else who means me ill, and they're connected to somebody else who means me ill. And that's not the case. The medical industry is full of really great, well-meaning people, and many of them save lives as well.
Absolutely. Yeah,
It's
absolutely.
also just a reality that the system operates in silos. And when you walk into a physician's office and you're complaining of psoriasis, or you're having trouble losing weight, whatever the issue is that you're complaining of, and they don't bring nutrition and lifestyle and products into the conversation, I mean, that's a telltale sign that you've got to do something else to take responsibility.
And sadly, I think that a lot of people, unfortunately, just don't think that way. They just want the easiest, quickest solution that really, when I say easy, that requires the least amount of effort, like physical, personal effort. So for them, I feel like it just, these issues and these symptoms just get worse over time until the point where they're like, well, I can't tell you how many patients have come into the clinic saying, I've been on all these medications and all these drugs, and I'm just sick and tired of being on all of them.
Mm.
And it's like, well, what are you doing to help get yourself off of that? And they have no idea what to do. They have no clue because they don't want to do something that is going to upset their doctor. And I'm like, well, you have the ability to start learning on your own, or to figure out, how do you want the rest of your life to look like? Do you want to be chained to these medications and to these drugs and to feel the way that you feel? Like, I feel like you can feel so much better and do the things that you want to do. It's just not going to happen overnight, and it's going to take time. But I feel like that's attainable, as
Mhm.
opposed to you just, being relegated to thinking that, oh, well, this is my life sentence, and I should be happy that, at least it's not any worse.
Yeah.
I'm like, well, what kind of quality of life is that?
Yeah. And I know how difficult it is. I just went off of 8 prescription medications over the course of a little over a year. So it took a while.
Congratulations. That's
Thank you.
amazing.
Some were easier than others, but it adds up quickly because then you have to take another medication because you're having issues because of one of your medications. And
But
so I got to 8. I was like on 2 for a long time. And then I was at 8 and I was like, what is going on?
but you don't
And
think that the system is designed that way?
designed that way is my point. And also coming off, I don't remember the ones that were the hardest to come off of. I don't remember feeling that much of an impact going on them,
Mhm.
but I remember coming off of them.
Yeah.
It was brutal.
Yeah.
And then I worked with a physician on, well, should we, taper more slowly? But over the course of doing that, I also got to learn so much about other things that I can do to support the detoxification process and support some of the symptoms that I might experience detoxing from those particular medications. So it
Amazing.
is possible, but I have a good friend. She's another mom that I met. She was on one of the ones that I was on, Lexapro, for a long time. And I sent her some of the research on SSRIs. She was already in the process of coming off of it.
Right.
And she was like, wow, I'm really glad I'm coming off of this medication, but she's having a really hard time. She's having tingling and numbness in her face. She's experiencing brain fog with, 3 young kids.
Yeah.
It can be really brutal. And I think it's meant that way because what they want is
Yeah.
lifelong patience, because lifelong patience equals trillions in profit.
I think I'm not necessarily a fan of Bill Maher, but one of my favorite, and I'm gonna butcher this, but one of my favorite quotes is, um, the system doesn't want you healthy, but the system doesn't want you dead either. It wants you somewhere in between where you're a customer for the rest of your life.
That's
And,
good.
but a lot of people just don't realize that, because they think, well, I'm at this certain age now. And I think for me, I have part of my inspirations to follow in this direction is my father. Unfortunately, when he was in his mid 30s, was diagnosed with diabetes, and diabetes runs in my family because nobody runs in my family, but except for me once in a while. But to see how his lifestyle was since he was in his 30s, and the amounts of medications that he's been on. I remember we just came back from family vacation with my parents back in December, and I went into my parents' bathroom to go get something. And I took a picture of this, but there was a stack of my dad's pills, the pills that he had to take, with the times that he had to take them and how many times that he had to take them per day. And there must have been 9 or 10. I'm not even joking, but there must have been 9 or 10 vials of these things. And one of the sad things when my parents come to visit us here in Nashville, my dad can only stay for a certain amount of time because he has a doctor's appointment or some other doctor's appointment that he's got to get to, or it's like some window of space where he's not at a doctor's appointment or not going to a doctor's appointment yet. And as a young kid, I was like, gosh, I don't really want to end up that way. Now I'm looking at when my dad was my age, his lifestyle, after he would go to work, he would come home and he would take a 2-hour nap. He would wake up, come have dinner, spend a few hours watching the news, and then go back up to bed. And that was it. And then repeat, and then put that on repeat for like 20 some odd years.
Yeah.
And I didn't know if I was going to say this or not, but last night, my son and I don't know where this came from, but we started playing tag spontaneously. And we were running around the kitchen table, and he was trying to tag me because I had tagged him. He was it, and he was really upset that he was it. But my wife was like, "Hey, you've got to go to bed in 5 minutes." But I was having so much fun. We were running around this kitchen table. My wife was like, "Hey, are you going to be putting him to bed?" And I was like, "Yeah, I'll put him to bed." She walks upstairs and we're running around this kitchen table. He's screaming and laughing. I'm laughing to death. And unfortunately, I'm part of it is I'm starting to watch this the show about zombies. But in my head, I was like, dang, if my kid ever becomes a zombie, I gotta like outrun this kid. For the next 45 minutes, we were running around the house, around the backyard, me trying to get away from this kid who was screaming, laughing. I was laughing and I was in tears. My wife had come downstairs like 2 or 3 times wondering, what the heck are we doing at 10 o'clock at night? You've got to put this kid to bed. I was having so much fun. But my point being was, not in a million years would have that ever happened to me.
Yeah.
At my dad at that age, there would be no, we would have to call an ambulance and get a defibrillator out because he would have passed out.
Yeah. Same. It's, and I wonder, and that's a great note to end on, but I wonder if it's just become so accepted here in the US that you think, well, obviously when you get older, then you have conditions that crop up and then you just need to be medicated and seen the rest of your life. And, 65 is kind of the magical age where you just retire, get sick, you have health issues. And you go to other parts of the world. I mean, even just down to Mexico, and you see like 85-year-olds just walking around, and it's normal. And they're not struggling. They're not, struggling to get around or be active. They're not taking a gazillion prescription medications and seeing a doctor every few days. They're just living their lives. Absolutely. And so something is clearly backwards here.
But I mean, you start going down that rabbit hole, and then you start getting accused of wearing a tinfoil hat or wearing a tinfoil hat from your friends. It's what I call the dark side, but I feel like it's so much healthier on this side.
It is. And it's worth it for the people that you get to help along the way. And, you just develop thick skin, right?
Well, their opinions don't really matter. For me, I tend to not take health advice from other people that are not as healthy.
That's a good rule of thumb, really good rule of thumb. Yeah. If you can't teach doesn't really apply when it comes to health.
Well, it's like, for me, I think the analogy is like, I would not take financial advice from someone who's broke. Right.
Yeah. It's good advice. Well, thank you for being my very first guest. You've been amazing.
What an honor and a pleasure. I'm like, this is amazing. This podcast is going to be, it's going to go through the roof.
Well, I'm going to post your tell people where they can find you online and on social media, but I will also post in the show notes so people can follow your tinfoil hat content.
So I am on, the clinic's website is musiccitychiro.com, and the Instagram handle is chiropractic_works_TN. And that's all the clinic content. And then my regular human being, non-working Instagram handle is Dr. Canete, DrCanete, for like people who want to like look at food, the stuff that I eat, my puppies, and just like weird content. That's my Instagram handle.
It's been lovely talking with a fellow weirdo. Thank you.
It's been a pleasure. Thank you so much.
Thank you for listening to this first official episode of United States of Sick Care. For more information on any of the resources or products or information discussed in this episode, you can email me at tamarayoungconsulting@gmail.com. That email is also in the show notes. And if you're interested in more information, I have a free guide to less toxic living, and I also help people switch to less toxic products and find resources in their area to support their health and wellness. You can email me for more information about that. And don't forget to like and subscribe so you can stay posted on new episodes. See you next time.